Welcome to this in-service presentation on counseling students with autism spectrum disorders. Autism spectrum disorder is a developmental disorder that affects communication and behavior. Although autism can be diagnosed at any age, it is said to be a developmental disorder because symptoms generally appear in the first 2 years of life. Given the significant changes in the diagnostic criteria and approach over the lifespan of the DSM, it is helpful for teachers and counselors to review the current criteria outlined in the DSM-5. According to the Diagnostic and Statistic Manual of Mental Disorders, people with ASD have persistent deficits in social communication and social interaction across multiple contexts and restrictive, repetitive patterns of behavior, interests, or activities. Severity is then based on social communication, impairments, and restricted, repetitive patterns of behavior, with symptoms that must be present early in a child's development, cause clinically significant impairment, and not be ascribable to other intellectual disabilities. Autism is known as a spectrum disorder because there is a wide variety in the type and severity of symptoms people experience. ASD occurs in all ethnic, racial, and economic groups. Although ASD can be a lifelong disorder, treatments and services can improve a person's symptoms and ability to function. The National Institute of Mental Health suggests some examples of the types of behaviors that are seen in people diagnosed with ASDs. Not all people with ASDs will show all behaviors, but most will show several. Social communication, interaction behaviors may include making little or inconsistent eye contact, tending not to look at or listen to people, failing to or being slow to respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with the back and forth of conversation, often talking at length about a favorite subject without noticing that others are not interested or without giving others a chance to respond, having facial expressions, movements, and gestures that do not match what is being said, having an unusual tone of voice that may sound sing-song or flat and robot-like, having trouble understanding another person's point of view or being unable to predict or understand other people's actions. Restrictive, repetitive behaviors may include repeating certain behaviors or having unusual behaviors, for example, repeating words or phrases, a behavior called echolalia, having a lasting, intense interest in certain topics such as numbers, details, or facts, having overly focused interests such as with moving objects or parts of objects, getting upset by slight changes in a routine, or being more or less sensitive than other people to sensory inputs such as light, noise, clothing, or temperature. Although people with ASDs experience many challenges, they may also have many strengths, including being able to learn things in detail and remembering information for long periods of time, being strong visual and auditory learners, and excelling in math, science, music, or art. Counselors may face a number of challenges when working with children on the autistic spectrum. 3 specific issues are outlined below. On tasks that require holistic processing, such as reading a social situation, individuals with ASDs often struggle. As such, when they are asked within a therapeutic context to reconstruct a challenging event for analysis with a counselor, they may have trouble seeing how disparate elements fit together to create a bigger picture. Considered as a jigsaw puzzle, individuals with an ASD can see only 1 or 2 puzzle pieces at a time and get frustrated because they can't see how the pieces they have and see as the most important fit into the larger puzzle. These core deficits affect therapeutic processes and the time it will take in therapy to process and restructure an individual's thinking about a particular situation. Next, because counselors have been traditionally trained to perform talk therapy with their clients, it can be challenging to work with clients on the autism spectrum insofar as these individuals typically talk using monologues and fact reciting. Reporting emotional or subjective content is often the biggest struggle for clients diagnosed with ASDs, and as such, clients with ASDs need therapists to view them in terms of how they see the world and assess how to build on the strengths and challenges associated with their unique condition. Finally, many forms of therapy are designed to provide social and emotional support by focusing on perspective taking and an increased understanding of the motivations, feelings, and opinions of others. Because children with ASDs may lack a theory of mind requisite to perform such perspective taking, such techniques may be less efficacious when compared with other populations. Some techniques, such as the use of social stories, may be particularly hard for individuals with limited capacity to conceptualize the motivations of others. Before treatment is employed, a thorough assessment by a trained psychometrician is needed. Measurement of academic achievement, adaptive behavior, cognitive capacity, developmental history, emotional and behavioral patterns, motor skills, sensory patterns, social capacities and behaviors, and speech and language abilities is necessary. Functional behavior analysis may be beneficial as well. Once an assessment is completed, producing a thorough picture of the child and family, specific therapies and behavioral interventions can be implemented. One of the most important activities conducted by a counselor working with families and children with a disorder on the autism spectrum is to educate others regarding symptomatology. Parents and siblings who have a thorough understanding of the child's issues and struggles, as well as strengths and preferences, have the opportunity to be more patient and helpfully involved in the child's life. School classmates of children on the autism spectrum who understand the disorder and know what symptoms mean can better accommodate the upheavals and oddities that may occur in class and on the playground. This can enhance inclusion and appreciation of the child inside and outside of school. The counselor plays an important role in providing family interventions, classroom guidance sessions, and community meetings to educate about ASDs. Another type of education intervention employed by the counselor is social and language skills training. Creating social skills training based on a list of logical, sequential, if-then social and communication rules can assist those with less severe dysfunction. Teaching to the individual's preferred learning style and cognitive strengths can assist in more efficacious learning. The counselor should not assume the child can generalize one rule for a particular situation onto another situation. Each issue will need its own set of rules in simple step-by-step fashion. Social skills training may be conducted in group format. An educational component teaches the rules of social engagement and reciprocity, followed by practice with age-mate group members applying such rules. Practice can assist the child to be more successful in interactions with others. Siblings can be utilized in this capacity in order to practice successful social interactions at home. One-on-one counseling between a child with a higher functioning ASD and a counselor can be beneficial, especially for more explosive or anxious children who can use assistance in emotionally regulating, reducing obsessive interest activity, and lessening excessive dependence on repetitive routines. Insight-oriented treatment are not suggested for the child with ASD, but may be helpful for family members in making adjustments. Advanced training in applied behavioral analysis can assist the counselor in effectively working with children with ASDs. The list of possibly helpful behavioral interventions is long and best used with an understanding of appropriate matching of struggles to intervention. There is no particular medication effective for reducing or eliminating the symptoms of autism. However, there are medications that may ameliorate specific related symptoms, such as those effective for treating depression, anxiety, or obsessive-compulsive disorders. One of the most effective roles the counselor plays is assisting the family to create and maintain routine and structure that helps all family members and keeps unnecessary stimulation down. Counselors further support the family by providing a place for family members to vent while validating feelings. Counselors help the family to adjust their thoughts and actions to fit the realities of living with a child with autism. The counselor teaches the family how to structure, build reward systems, and otherwise contribute to global family stability. The counselor also acts as advocate, consultant, and treatment team member for the child and family within agencies, schools, and medical and other treatment facilities. The counselor can also be a powerful support to families working to implement the advice of an occupational or physical therapist. Here is just a small sample of the many available materials and intervention supports for counselors working with students with ASDs. The National Association of School Psychologists provides guidelines in social skills interventions for individuals with autism spectrum disorders. ABP Pathfinder provides autism therapy through applied technology. Software allows the processes of ABA therapy to be managed in a comprehensive package built specifically for therapy professionals. Body Talk teaches children and teens with autism and other developmental disabilities the language of nonverbal communication with the practical strategies developed by veteran special education teacher Pat Chrissy. How to Set Up a Classroom for Students with Autism is a manual for teachers, paraprofessionals, and administrators. And Relationship Development Intervention is a developmental model that addresses the core issue of ASDs, such as motivation, communication, emotional regulation, episodic memory, rapid attention shifting, self-awareness, appraisal, executive functioning, flexible thinking, and creative problem solving. Below is the evidence for the challenges counselors working with students with ASDs are likely to face, as well as the empirical support for the techniques suggested in this presentation.